I'm Rachel Pryor. I live in Port Jefferson. And I guess I'm sure you're aware of the data that about half of U.S. bankruptcies are caused by healthcare costs, and that the majority of those people actually had health insurance, at least at the time that the illness began. And so my question for you is, what is the current legislation? How does it address the financial security of middle-income Americans, many of whom have health insurance but may find themselves at severe financial risk if they have serious illness?
Thank you. Thank you. First off, 85% of Americans have coverage. For some, it is coverage that they're very comfortable with and pleased with. For others, there are gaps in their coverage. The bill does a couple of things. It protects unequivocally the right of anyone who has coverage that they like to stick with it. It also prohibits, as I said earlier, it prohibits existing insurance carriers from engaging in three practices that right now, again, don't happen in New York, but are commonplace across the country. Denying coverage to people who have pre-existing conditions, canceling coverage when people get sick, and not renewing policies when people make claims against them. They would not be able to do any of that. If the family or the individual that's covered has employer-provided coverage, as I said earlier, that employer has three choices. One is to stick with the carrier that they currently have. The second is to select a new carrier. And the third is to pay an 8% payroll tax. And those employees would then go into the insurance exchange, where they would be able to pick whatever policy that they wanted. The insurance exchange, if people go into that exchange and therefore do not have employer-provided coverage, they would be eligible for so-called affordability credits if their income is, if for a family of four, for example, income of less than $80,000, a single person income of less than $40,000. And they would have affordability credits that would help them afford on a monthly basis their premium. And that would be a sliding scale that would limit the amount of monthly income that would go to insurance payments. The other thing that the bill does, about 30 million of the uninsured people, of the 47 million that are uninsured, are people that are basically the working poor. Families, people who work, but work for employers that don't provide them with coverage, but they make too much to be eligible for Medicaid. So we're doing two things. One, we're providing an increase in the eligibility for Medicaid, and the second is we're providing these affordability credits. Hopefully, in the course of doing both of those things, we're going to wind up covering all but a couple of million people of those who are uninsured.